And we're on your side with a series of investigative reports looking at areas in our state that lack resources others may take for granted. This morning, we're starting things off with a closer look at one rural hospital that's struggling financially. Blake Stevens reports.
A sign showing the pride this community has in its hospital. Jamestown Regional has been closed now for 6 months. Former ER nurse Karen Cooper believes that's dangerous for people living in and around Fentress County.
We took care of strokes. We took care of massive fractures with wrecks and things. We took care of heart attacks. There were lives saved over there, lots of them.
Patrick Flowers is turning the water off at one of his rental properties today, but other days involve power tools. Now there's no hospital up the road if he's injured.
You know, a lot of things they can't do here, but a lot of things they can. One of the big things is the emergency care. When you need that care, you need it quick.
Dr. Richard Clark offers urgent care across the street from the hospital and still sees a need for an emergency room.
Time is brain, time is heart. And so the quicker that you get to someone, the quicker you have the proper ability to assess and treat, the quicker you can save those organs.
Jamestown is owned by the same company that owns Big South Fork Medical Center and Jellicoe Community Hospital. The company's 2018 SEC report shows it hemorrhaging financially. That's not uncommon in rural hospitals. Roan Medical Center CEO Jason Pallant says survival depends on a lot of factors, including how many people live in the area and how many of them have private insurance. Money made from those payments help make up for losses, some of which come from caring for the uninsured, about 1 in 10 patients here. Then half the hospital's patients rely on Medicare, which he says offers no profit. Another 20% of patients use TennCare, which does not fully cover the hospital's costs.
There's charity care that's done in these rural communities on a daily basis, and that's part of that. And so with your no insurance patient and part of your TennCare or Medicaid patient, there is write-off with that.
Despite those odds, he says they're doing well, even on track to break even or turn a profit this year. A lot of it has to do with their more than $70 million new hospital and the pride this community takes in it.
There's not many times people will drive from large cities past hospitals and come here. But also in that same regard, we can't have people in this community drive past our hospital going to the big cities and stay viable.